In terms of the Sanofi vaccine, first of all, I will say that we know that a safe and effective vaccine is going to be the surest way of exit from the COVID-19 pandemic, and this is why the European Commission has the vaccine strategy, and we're working with and for the Member States in order to ensure a broad portfolio which will help us and have a safe and effective vaccine when this is available for all. In terms of predictions, I'm not able to make a prediction. We have seen how in clinical trials, phase 3, you can face many uncertainties. So I would not go as far as putting any predictions in terms of timelines. We're following all very closely together with, of course, the European Medicines Agency, and we await to see the results. Thank you.
Thank you. Dr. Amann, perhaps on the mesure de précaution and collective immunity?
Yes, regarding the measures, it's very clear that closures of shops and venues has a societal impact. The basic measure that has to be taken is keep a physical distance. And put on a mask if you can't, and hand hygiene. Now, taking these more drastic measures of closure of shops and venues, bars, restaurants, depends on how well it's possible to ensure these basic measures in these venues. So if it's possible to have distancing in a restaurant or in a bar, then I think it's a different consideration to close or not than if it's such a small place that only one person can, or a few persons can be in there anyway. So I think it's very difficult to give a generalized advice here, but the basic measure is if you are able to keep distance, then that's the safest thing. Now, regarding the herd immunity, this is something that is under constant observation. From the data that we have until today, the level of people with antibodies is still not very high. So in most places it's maximum 15%, usually lower, and only on very small local communities that had a high exposure during spring, it is higher. So I think it's still not the time to rely that most of the people actually cannot be infected. On the contrary, most of the people still can be infected. Thank you.
Thank you.